Now we are especially pleased. We're going to have a discussion, and I will be joined with Melinda French Gates and David Leonhardt to talk more specifically about a lot of the issues underlying the work we're doing at the foundation in No Ceilings.
Ladies and gentlemen, joining Secretary Clinton, please welcome co-chair and trustee, Bill and Melinda Gates Foundation, Melinda Gates, and our moderator, editor, The Upshot, The New York Times, David Leonhardt.
Thank you all. Thank you, Secretary. So let's start by looking backwards. It's 19 years ago this month that you gave your speech. I think there's an interesting argument that progress in the developing world, where I want to start, has actually been more rapid than people expected back then, in part because of the China boom. Obviously, there are terrible problems, but the World Bank has said that women in many countries have made progress in one decade that it took women in this country decades to make. Do you think it's fair to say that progress over the last 2 decades in developing countries has been more rapid? And what do you think the main reasons for progress are?
Well, David, I think that we have seen progress, and we are interested in our work in No Ceilings, that we're partnering with the Gates Foundation and that Melinda and Chelsea and I are leading along with other partners, is to get below what appears to be progress and to really understand what has occurred, what difference it has made, and where the gaps still are. So I agree with you that based on where we were nearly 20 years ago, we've seen a lot of improvement. We were just talking about one of those issues, primary school education being much more widely available to and taken advantage of by women, some of the health goals that Melinda's been really focused on. So I think in health and education, we've seen progress. Now, some of it is because we were starting at a fairly low level. And so it looks and is dramatic to see the improvement. But in economic participation, in political participation, and in peace and security issues, we have not made as much progress in the developing world.
One more quick thing before I turn to Melinda. The developed world seems quite different. I mean, to put it bluntly, is life better for women in the United States and Europe than it was 20 years ago?
Yes, it is. It
How?
is. Well, there are a number of indices that demonstrate it being better. Again, on health and education grounds, for example, on political participation. Again, starting at a low level, we've seen increase on economic participation. But it is fair to say that there are still obstacles that may not be as apparent, such as legal restrictions have been knocked down, regulatory regimes have been changed. But if you look at economic participation, we are still, in our own country and even in other developed countries, not yet at a level that we could term parity. Certainly not equality. The poverty census report that just came out last week showed that women still make considerably less than men do. We've gone from 77 cents to 78 cents compared to $1. That's hardly groundbreaking progress. And we still have a lot of cultural, customary, even attitudinal, psychological barriers. And the one other point that I would make about our own country is that poor women in our country, uneducated women in our country, are very vulnerable. Melinda and Chelsea and I were just talking about the dramatic increase in HIV rates among poor African American and Hispanic women in the southern United States. We have also, unfortunately, seen too many examples where the combination of poverty and lack of education is actually a toxic brew, and poor women, uneducated women in the United States have a lifespan that is actually decreasing. So although many of us in this room have seen enormous changes, when I was a young woman, there were colleges I couldn't go to, scholarships I couldn't apply for, jobs that, had basically invisible but very clear sign saying no woman need apply. But so we've made a lot of progress, but we still have our own challenges we have to deal with.
And much of that progress was in the 70s and 80s as opposed to more recently. Melinda, the Secretary's mentioned education a couple times. It seems to me if you read the evidence, there's an argument that education is the killer app of gender equality and of development more generally, that education doesn't just help you learn to read, it doesn't just lift your incomes, it makes you healthier, it helps you participate in politics, it changes society. If that's right, should we essentially be taking some of the resources that governments and foundations and NGOs are now spending on other things like health and be diverting it to education with the idea that you can actually help those other things by spending on education?
Well, I would say this. I think education is absolutely fundamental. What it does to lift up a young girl or boy's chance in life is enormous. We see that here in the United States. You see it around the world. What I'm happy about is that we're finally really talking about girls in school. You know, we finally have a goal where we're measuring, okay, are enough girls getting primary education? But we're really not asking the second and third layer order questions that you need to ask, which is, are they getting a quality education? Are they going on to secondary school? Are they getting a quality secondary education? Unless you have that data and really look at it, we're really not going to know how well we're doing for girls around the world, and I think that's important. On the health side, I would absolutely say no, we should not divert resources from health to education, because if you don't grow up with a healthy life, you can't begin to get an education. And so these two things go hand in hand. They create this virtuous cycle. That is, if a girl gets educated, she's twice as likely to educate her daughter. She's more likely to take access to the healthcare sector in her country. But she has to do certain things to get to that point. That is, make sure that her children are vaccinated, make sure that she stays alive in childbirth, she goes to the clinic to give birth, make sure that she breastfeeds her newborns. We know that that saves a newborn's life. So she's more likely to do those things if she's educated, but we can also reach her with a frontline health worker if she's not educated to get her started on that track so she's doing all the right things in her family to have healthy children so they can go on into education. And when I go out in the field to talk to women and girls these days, which I do a lot of, it's so interesting because I'll go in to talk to them about health, and they will absolutely talk about that, and they'll talk about the difference these life-saving tools make for them or a frontline health worker. But when you ask them, what are your dreams? They always talk about their children and getting their son or daughter educated. And I think we have to keep that in mind. And I think that's why the data in all of this that we're working on with No Ceilings is to help us to get at those layers and to figure out for girls and women, are we doing the right things in health to help lift them up, to make sure that their children get the proper nutrition so they can go to school and learn, and to make sure we're asking the right questions about girls' participation in education. And I think Secretary Clinton and I have a video that we'd like to show about this No Ceilings project, if this is a good time.
The No Ceilings Initiative is collecting global data to paint a picture of the progress of women and girls over the last 20 years. The information consists of more than 1.8 million data points from over 190 countries. Looking at education, the number of children attending primary school has significantly improved in the last 2 decades, and the gap between boys and girls has narrowed in many countries. But compared to primary school, secondary enrollment drops dramatically. In sub-Saharan Africa, there are 1.5 million fewer girls than boys in secondary school. Closing the gender gap and increasing women's education has important implications for the health of women and their communities. In the past 20 years, the number of children who die before the age of 5 has been cut in half. Over 2 million of the lives saved each year can be attributed to advancements in women's education. Despite the progress, disparities still remain between men and women in the workplace. Even in developed countries, women's salaries are 15% lower than men's. That means for every dollar earned by a man, a woman averages 85 cents. One reason for the gap is that women spend more time on unpaid labor, such as domestic work, caring for household members, and additional unpaid tasks. In India, where the gap is greatest, women spend almost 6 hours a day on unpaid labor. Over the last 20 years, the gender gap in the workforce hasn't changed. Yet raising women's participation can lead to measurable economic and social gains. If India closed the gender gap in its workforce, its GDP would grow by over $1.2 trillion. We are counting women and girls because women and girls count. We've made a lot of progress, but there is still unfinished business. How do we reach full participation for women and girls in the 21st century?
You mentioned that when you talk to women, they talk about their kids. It reminds me that in this country right now, we hear a lot of skepticism about whether education's worth it, but people don't tend to be skeptical about it for their own kids. It's only for other people's kids, right? You mentioned motherhood, Secretary. The video mentioned it as well. It strikes me that in some ways that is a different category, that we can get girls enrolled in school in equal numbers. I mean, girls in this country are whooping boys in school, right? Doing much better. It seems like we're making very little progress for dealing with this motherhood penalty. You look at the most successful women in business, in government, not the two of you, but a disproportionate number of them do not have kids. And it seems as if there is no obvious solution. European countries that have done very generous leave policies sometimes find that it marginalizes women. What's the right approach to try to address this fact that men aren't going to have kids, women are, and that creates an enormous issue around the world?
Well, David, I think you can see from the video and what Melinda has said, we were really in the search for the data that we can use to make comparisons about what works and what doesn't work. What we do know in our country is that the absence of quality, affordable childcare, and affordable and quality have to go together, is a very big factor in limiting and sometimes even ending women's participation in the workforce, despite what their personal decision might have been if they'd had childcare. The absence of paid leave is a strong signal to women, and particularly mothers, that the society and our economy don't value being a mother. And you can either make a choice. You can be a good worker in your job, or you can be a good mother, but you can't be both. And I just reject that. I think that if we did more to support paid leave, family and medical leave was a great step forward. First bill I think my husband signed, just as President Obama. First bill was the Lilly Ledbetter Act. We've been trying to go after the inequities that are baked into our system. And if we did more on childcare and we did more on paid family leave, particularly for new mothers, we would be sending the right signals. You do point out that there are a lot of women who think that they had to make a choice. Now, maybe that was their choice and they should be supported in making that choice, but for a lot of them, it was a choice that in effect was forced on them. I can either pursue my career during the time period when it would be most likely that I could have a child or not. And so there's I think a growing awareness in our own society that we can't just give lip service to the idea that mothers are important. We have to provide the support systems that enable women to make the choices that are right for them, and becoming a mother and not being penalized for that is something that we have to try to remedy in order to open the array of opportunities that women at all ages should have.
What's the famous statistic? Us and Papua New Guinea are the only two countries without paid leave, I think.
Well, yes, there is something to that, I think.
Yeah. Another place where it seems to me there are tensions, Melinda, is this question of what we measure, right? It probably for a long time, for all of our lifetimes, women are going to be doing more unpaid work than men, more household work, more caring for family. That's basically unmeasured when we think about how well off we are. Is there any way to change that, or is that sort of a pipe dream? I mean, is there data, which you spend a lot of time talking about, that can give us a better sense of what women's contributions are right now?
Well, we need to redesign the way we collect the data today, and I think this is why data is so important. When I think about being in business, when I was at Microsoft, we didn't make decisions without data. Data instructs where you go and how you work. The private sector just expects data, and that's why in this development work and in any work we do when we talk about gender, you have to have data to know where you're making progress and even where you're having unintended consequences. So for instance, to your question about collecting data about women in other parts where they get paid or don't, just the way we collect household survey today data in a whole host of countries across Africa and India, first they ask who's the breadwinner in the family. And once they get the answer to that question, they don't ask if there's another breadwinner in the family. They don't even measure what women actually earn. And if you look at a lot of households in Africa, the man may be the primary breadwinner, but she's getting income from her kitchen garden or other crops. So we have to design surveys in ways that we include women and we include the right things that are factors for them that they face in their daily lives. So you start there. And then I think you have to have all kinds of layers for women. So I'll give you, for instance, some of the sites we work in India, we're just starting to learn about the domestic violence that exists in these sites in their own marriages. And that affects women's health-seeking behaviors for their children and for themselves. They're less likely to have their child immunized. They're less likely to show up into that clinic to give birth. So we need to do things with these frontline workers to reach those women in different ways to make sure they can get those health-seeking behaviors. But unless you're collecting the data about what's really going on in these women's lives holistically, not just in one sector or two or three sectors, but holistically, we won't be able to make good decisions. And I think that's part of what we're trying to do with No Ceilings is show the global level data, but then when you do the work is to go much, much deeper to uncover what should we be doing, what concrete actions will make differences for women.
You know, and David, I would add, because Melinda's right, what we are trying to do with this data is to, you know, not only demonstrate what is happening, but like her example from the household survey, you know, what would make a difference in trying to get better data. It's not just what we have and how we analyze it, but what more we need. But I think that there's also the issue of how do we try to begin to evaluate this unpaid labor. You know, I remember being in Africa in the 90s, and I saw women tilling fields, I saw women carrying firewood, women carrying water, women in the markets. And when I asked the economists we were meeting with, how do they take account of all this labor and what we saw in the video, the unpaid labor, they said, well, we don't. You know, it's not in the formal economy, therefore we can't measure it, and we don't measure it. I think we are now sophisticated enough to be able to begin to think through what are the values that are inherent in the unpaid labor. Because if, you know, women in any society stop working, the economic consequences would be immediate. So it's getting the data, it's understanding how we get better data, but then I think there is this broader issue that some economists and social scientists are beginning to think about, which is how do we really take the old GDP and imbue it with some other data or other qualities that are going to help us evaluate the quality of life for not just women, but for society.
And I mean, some of that is we want to do it for statistics' sake and accuracy's sake, but some of it is because it affects decisions, as you're saying. Yep. So let's end on sort of a bigger note, which is you mentioned the struggles of poor women in this country. The census report we just had shows that median income is lower than it was 15 years ago. And most low-wage workers are women, so this affects women more than men. Is there some fundamental way in which our economy, and not just us, but Europe as well, is broken? Or is it tweaks that we need to get it working?
You know, David, I think a lot about this because I'm not sure it's just tweaks that will be sufficient to deal with what are trend lines that demonstrate leaving further and further behind people without the education and skills to be competitive in this much more globalized economy. But I do think there are some fixes that could at least give us some time to evaluate what we need to do and what works. For example, you know, affordable childcare, preschool programs, the kind of paid leave programs, those are not just nice luxuries for women. They would fundamentally free up women to be in the workforce. if they had the skills and the desire to do so. And we could begin to sort out, because I'm not sure we have the best data we need in our own country right now. What's really behind the stagnation in wages and in workforce participation? We have some, I think, very educated guesses, but I'm not sure we really know. And we do see similar trends in European countries that had very different social approaches. So maybe it's not about the political or social systems that have been in place for decades. Maybe there's something else more fundamental going on in the world of work. And technology has obviously been a great change agent for mostly good, but also making it difficult for some jobs ever to be available for educated or even uneducated people in our society. So I think that there's a lot going on in the economy that we need to do much more to understand, but we could, in the meantime, be making some fixes that would give more people more opportunity, and we could examine our assumptions about what work should be in the 21st century. Because I come from the, my family background, my own personal experience. Work is an essential part of one's purpose in life. And if you don't have that, and we now have 6 million young people in this country who are neither in work nor in school, that sets a series of actions in motion that are going to be disadvantageous to them and to our society at large. So the short answer is, let's make some fixes that we think would work and help, but then we need to have a much more substantive conversation about what we're going to need to do to make sure we have a population that can get jobs, and that those jobs are going to give people a good economic base. And raising the minimum wage is something that is long overdue. There are too many people who work full-time and are below the poverty level. So there are things we can do right now, but then we're going to have to look hard at what really would work. And going to Melinda's point, data, data, data. We can't just live in an evidence-free zone. We need, as Jim Kim said in our first plenary, evidence-based optimism about what we're capable of doing here and around the world.
And then just remembering that behind all of these data points that we're talking about, and we need this data so we take action, so finance ministers take action on behalf of women, but I think also keeping in mind that behind all of these data points are real lives, real human beings that have day in and day out struggles, whether it's in the United States, whether it's somebody living in Nairobi, and how do we care for all human beings in a way that gives everybody dignity? And I think giving women the ability to thrive and live the lives that they want for themselves and their children, that's just the right thing to do in this day and age, and the data all points in that direction.
It is just plural for facts, right? Thank you both.